Hi, thanks for joining us to talk about diabetes. So, my name is Keane and I'm the practice manager at Urban Village Medical Practice. And I'm joined by Jed. Jed, do you want to introduce yourself?
Oh, hiya, I'm Jed. I'm one of the practice nurses and trainee advanced clinical practitioners at Urban Village. I've worked here for 7 years and I have a specialist interest in diabetes and I take care of the majority of our patients with diabetes at the practice.
Fabulous. So, our patients who are diabetic will know you very well.
Yeah.
Okay. And is that so? There's two different types of diabetes, isn't there? What are those differences?
So we've got type 1 diabetes and type 2 diabetes. There are lots of other subgroups of diabetes as well that are quite complicated, and the other subgroups are quite rare. So predominantly we see mostly type 1 and type 2. So type 1 diabetes tends to present in really young people, so usually in childhood or early adulthood. Rarely we see it present in adults. And basically, it means that your pancreas has stopped working completely and it doesn't really produce any insulin at all.
Okay.
And these people usually present with the first presentation quite unwell and will usually need to go on insulin straight away. We're not sure of the exact causes of type 1 diabetes, but it's thought to be linked to an autoimmune disorder. And there's still lots of
Okay.
research that's needed on that, but all of the evidence so far points to the thought that it is an autoimmune disease. So with type 2 diabetes, that's more common in people who are over the age of 65 and usually presents later, although we do now see younger patients in the 30s, 40s, and 50s with type 2 diabetes. So the pancreas still produces some background insulin. So usually these people don't always need to go on insulin injections straight away. Usually in the earlier stages, it can be managed with diet and lifestyle changes. And then sometimes people need to take oral medications as well. It is a chronic disease. So sometimes as the disease progresses over time, if it's not well controlled, then people may need to go on insulin as well, but not always.
Okay. So type 1, something that is diagnosed when you're particularly unwell. Type 2, you
Yeah.
might not know you've got it
No,
then.
you might not know you've got it, and the onset of symptoms tends to be more gradual. So we'll
Okay.
generally see people who might not realize that they've got diabetes complaining of things like, well, I'm feeling really tired, or I'm feeling more thirsty than usual, or I'm waking up in the night several times, passing water, or I've lost quite a bit of weight.
Okay.
And then sort of if you kind of was hearing those kind of things for somebody who you might think fits the picture potential diabetes, then you would do some tests to confirm it.
Okay. And do we sometimes pick those patients up when they come for a kind of a normal health check?
Yeah, so sometimes people there's people out there who are walking around with no symptoms at all, and who are plodding along perfectly fine. And when we invite people at the age of 40 for their NHS health check, sometimes we just pick it up incidentally without really looking for
Yeah.
it. And they've got no symptoms. So we do pick things up just by routine screening sometimes as well.
Okay. So if we were thinking about one of those people that is diagnosed as type 2, and I suppose it might be a bit of a shock to them that they've got it, had some very kind of mild symptoms. What happens after that diagnosis?
So this is where it's really important to have your review appointments with your practice and make sure that you book in for a review with your practice nurse, because they will be able to explain everything to you about what will happen next. So usually the person will be booked in for a diabetes review, which will include checking the blood pressure, checking the weight, doing the foot check, going through diet and lifestyle advice, looking at smoking and alcohol, all those kind of things that can impact your general health, but can also impact diabetes as well. There's a whole wealth of resources out there that we can use if people need support. So things like Be Well is a really good service. Diabetes UK has lots and lots of information. That's also really useful. But yeah, generally the practice nurse would be your first protocol, and you would have the opportunity to sort of, let them know what your fears are, and let them know what you're struggling with, if you're struggling with anything. You can ask questions if you don't understand anything when they explain things to you, because we understand that not everybody knows exactly what diabetes is
Yeah,
and exactly what to do. And
yeah.
that's what we're here for.
Okay. You said lots of different tests then, and I understood most of them, but the foot test, now that's not something we normally do with people. What happens in a foot test?
So when somebody has a diagnosis of diabetes, it can increase the risk of cardiovascular problems. So it's a screening. We don't do the foot check to diagnose problems. We do the foot check to try and make sure that everything is as it should be and pick up any potential problems earlier. So because people are at increased risk of cardiovascular problems when they have diabetes, one of the things we do is look at the feet. Because these little blood vessels in the feet, little nerves, and sometimes they can become damaged with cardiovascular problems. So we check the sensation and we check
Okay.
if it's a good colour and that it's healthy. And if there are any problems, then we refer on to the foot care team.
Okay. And when you say cardiovascular disease, that just means circulation, does it?
Yeah,
Yeah.
yeah. So,
And it
so,
affect,
so
sorry,
yes,
go on, Jed.
it affects the whole of the circulation. It's not just the heart, so all the vessels that are connected to the heart as well.
Okay, brilliant. So you're going to do blood pressure, height, weight, bit about food, and check our feet as well. And people think they only get 10 minutes with this here at the practice, but you get longer for that appointment, don't
We do
you?
get longer for that appointment. And also, we recognise that sometimes if we give somebody too much information all at once, it can be a little bit overwhelming. So sometimes it might be beneficial to do an initial appointment, give some information, see how the person sort of absorbs that information, send them away for a couple of weeks, and then maybe get them back. And then, because in that time, they might have had a chance to think about more questions that they want to ask, and that's fine. They can always come back again and see us if they're not sure of something or they need more support with things. That's okay as well.
Fabulous. So if I'd come to see you today and you told me that I was now type 2 diabetic, and I was to go home and make some lifestyle changes, what are the kind of first things that I should be doing?
So the first things are the things that people would initially think about that's associated with diabetes is sugar. So your refined sugars, things that you find in sort of your cakes and your sweets and your biscuits and your fizzy drinks. So it's really important to try and cut those out or minimize those. But things that are a little bit less obvious are like your carbohydrates. So things like your bread, your potatoes, your pasta, your rice. Trying to reduce the amounts you're eating or your portion sizes and trying to switch to healthier varieties, so like your brown and whole grain varieties. So things like that can help. Alcohol also contains a lot of sugar, so being careful with your alcohol intake. Exercise is a really big one. So we know that not everybody, because of time, because of resources, because of social circumstances, finance, whatever, we know that everybody can go to a gym and do loads and loads of exercise. And that's not the expectation that we have
No.
on all of our patients. There's loads of help out there. Again, Be Well is a really good resource that we use for diet, lifestyle, weight management. And they can help if people are interested in taking up swimming or going to the gym, they can help with things like that. If because somebody's got, sort of physical problems because of other chronic medical conditions and they can't physically do loads of cardiovascular exercise, there's things like swimming that they can refer you to, and there's also they do exercise classes that are more gentle, so things like chair exercises.
Okay.
So it's still possible to do some
Yeah.
physical level of activity in most cases, and there's ways around it and it's tailored to the individual person.
Okay. So if we were thinking about, I've come out of your clinic and I'm going to walk across to Aldi to do my shopping because I'm all enthusiastic about starting this new kind of way of life. And I normally have big bowl of cereal for my breakfast, and then I have a sandwich for my lunch. And for tea, I'll have meat and three veg with a load of potatoes. I'll have a bit of bread as well because I want to fill up. How could I change that kind of typical, I suppose, diet?
So I suppose it's looking at your portion sizes and sort of like looking at what sort of food groups you've got on your plate. So things like your proteins are like your chicken, fish, things like that are much healthier for you. And they do fill you up as well. Eggs are another good source of protein. Trying to make sure that you're getting your 5 a day in. So as much veg as you want on your plate, really. And just if you want to have some potatoes, just maybe trying sweet potatoes as an alternative because
Okay.
they're a bit better. And just trying to fill your plate with healthier things rather than your starchy carbs. Snacks as well. So if you want, you want for snacking, looking at healthier options like fruit, yogurts. But a good thing as well that they do nowadays, they put traffic light system on food packaging. So you've got your red, your amber, your green, and everything's labeled and it tells you the sugar content. So if you're looking at sugar content and carb content, you're looking for things that are a bit lower. So try and stay away from things that are red and try
Okay.
for things that are more green and amber.
And is there something on the label we should look for as a percentage or a
Yeah, there is. There's numbers, but I find that colours are a bit easier to work out for
yeah,
most people. Red signals danger. I think most
yeah.
people see something that's red on your packet for your sugar and your carbs.
Okay. So if I went over the road to the supermarket and I was looking at all the different cereals, go for the ones that are green, amber, and not the sugary ones that I really
Yeah,
want to eat for my breakfast.
that's right.
Okay. There's another term that we hear people say they've got, and that's pre-diabetes. What does that mean?
So pre-diabetes, again, this is picked up a lot when we do the NHS health check when people turn 40. Pre-diabetes is a term used to describe people who are at an increased risk of developing diabetes in the future. So the test that we use to check for diabetes is a blood test called the HbA1c. So anything above 48 millimoles means you have diabetes. But there's a range between 42 and 47 millimoles where you're in that what we describe as a pre-diabetic range. So it doesn't mean you've got diabetes now, but it means if you don't make some changes to your diet and lifestyle, and if that level is just left to continue, then you are at risk of it tipping over into that diabetic range. So there are things that you can do at that stage though to try and stop that from happening, such as we've discussed before, making diet and lifestyle changes, increasing your exercise, cutting out your sugar, cutting out bad carbs,
Yeah.
trying to do, lose a bit of weight.
So if mine came back at 46 and I did those things, I had sweet potatoes, I'd stopped having too much bread or carbs and sugars, that could move down without me having to have any medication.
It could, yeah, absolutely.
Okay, fabulous. That's really, really good for people to understand that it doesn't mean necessarily you're on medication for life. It's in our control to make those changes. So you have your first test and you send me away and I'm going to make those lifestyle changes. And then do I come back and have another one of those blood tests to see what those impacts have had?
Yeah, generally speaking. So for people with diabetes, we leave it sort of if you've got a definite diagnosis of diabetes, so you've had two blood tests to confirm a diagnosis, because we don't just base it off one, we base it off two. So we do two tests a month apart. If you've got diabetes and you're just over within into that diabetic range, it doesn't mean that you'll need to start medication straight away. We usually send people away with lots of information, help and support, and try and empower them to make those changes. And then we get them back within sort of 3 months and check their levels again. Now, at that point, if despite all of those changes and that person's struggling a bit, the level hasn't improved, then yeah, we do talk about whether we need to start some medication. But it's always, it's always like a joint decision making. If that person's like really like, no, I really don't want to, I really want to keep at this, then there's always scope for us to sort of move the goalposts a bit, and everything should be tailored to the individual person.
Yeah, and that's a conversation and a joint decision between you
Yeah.
and that patient. Fabulous. Um, and if you said people over 65 are more likely to get diabetes, but that age is kind of coming down. So I'm a normal, healthy person. Do I just follow those same rules? So I look out for the traffic lights and I do a little bit as much exercise as I can for my abilities. All those things will help me to stop getting diabetes.
Yeah, so everybody should be trying to follow a healthy diet and lifestyle as much as we reasonably can. And I think the government sort of recommends about 30 minutes a day. That everybody should be trying to achieve. Eating sensibly, drinking plenty of water,
Mm.
no more than sort of 14 units of alcohol a week. Trying not to smoke. Because it's not just really about, I mean, diabetes is important, that's what we're talking about today, but there are other sort of, heart disease, cardiovascular disease, kidney disease, strokes, heart attacks. making those lifestyle changes and trying to maintain those lifestyle changes helps prevent a whole host of other diseases as well. It's not just diabetes. Diabetes is one of the big risk factors. Yeah.
And we talked that we weren't going to talk in particular about the health check, but we've mentioned it a couple of times, haven't we? So if somebody's over 40 and doesn't have a chronic disease, so doesn't have diabetes, asthma, COPD, are there any more I've missed? They would get this as part of their ongoing treatment. But if you're otherwise healthy, you can come for an over 40s health check. Is it every 5 years, Ged, or every 3 years?
Every 5 years, providing that everything's okay. Obviously, if we pick up any problems, like if we do pick up pre-diabetes, or if we pick up, raised cholesterol or something, for example, or if somebody's got a raised BMI, body mass index, and a bit overweight, then we probably monitor them a bit more frequently and trying to support them with improving that.
Yeah. Okay. So people who are listening to this that haven't seen us for a long time because they're healthy and they're over 40, they could just put a form in on our website asking for a health check, and we can. There's something quite empowering about knowing your own numbers, isn't there? Knowing that you're all right and that you're doing okay, and that
and
bit
obviously, the other thing as well, okay, is that all of these things, the earlier they're identified and picked up, the easier they are to get on top of and treat, or even reverse in some cases for diabetes. So whereas when we catch things that are later on, when somebody's already got loads of signs and symptoms, often it's a bit more difficult to try and reverse things. So it's better to pick things up early by coming for routine screening than to leave things.
Fabulous. Thank you so much for your time today. I know how busy you are, Ged. Anything else I've missed?
I don't think so.
No? Okay. That's great. Thank you.
All right. Thanks.
Thanks. Bye.